Hi, congratulations on getting such good ranks and welcome to the gang of postgraduates. You're now officially the cream of the country, and I'm sure this is a very exciting phase of your life. I'm also very sure that to make a decision of which branch to do when you have such good ranks might be a little tough one to take personally. So we are here to help and especially to discuss about obstetrics and gynae as a branch. Now, Obs and Gynae, all of you know, is a very demanding branch. It's a mentally, physically draining branch. Let me tell you, those who have come so far in the discussion with me, you will understand that any clinical branch is going to be demanding, whether it is medicine, surgery, pediatrics, orthopedics, or Obs and Gynae. So, if you're deciding to become an obstetrician gynecologist, it's not that it is that one chosen branch which is the worst. Please, I'm trying to take out the negatives about this upfront itself, because I know all of you understand it has a lot of noise happening around this branch, and I know you don't like that noise. But see, that noise is because of so many factors, and I'm not going to dwell in those factors, but look at it in a different way. Every department has some or other problem regarding the working hours or the demanding schedules or the personal life which gets affected or the family life which gets affected. So, you chose to become a clinician, and when you choose to become a clinician, Obs and Gynae is one of those branches which gives you the best clinical life, because it has got a whole lot of surgical outlet. It has got so much of enthusiasm of you coming out because you're going to do any surgery below the umbilicus, which is going to be involving full surgical skills. Not just that you're going to do a cesarean, you're going to be things like prolapse surgery, you're going to be doing hysterectomies, repairs and cancer surgeries. Of course, all of this you'll want to do even laparoscopically when you become a senior resident and start specializing in this surgery. So, it has got a lot of medicine also, and you'll be dealing with the patient completely as a physician, be it the hypertensive management or the diabetic management or the management of epilepsy in pregnancy. So, you'll feel that you're in charge of a patient, whether it's a medical disorder or a surgical disorder. Of course, there are places where you need to have references with your medical friends or your surgical friends, but in itself, it's a complete branch. It gives you the satisfaction of understanding that you can be in charge of this patient completely, in addition to being in charge of making sure that the baby which is growing in this mother is healthy and is coming out in a perfect way. So, yes, it has got that excitement of doing a delivery also, and believe me that labor room is a perfect place to build up your character. Yes, you know, at 9 o'clock in the morning, when you're sitting in the OPD and you're well dressed and you're fresh from your home and you had your breakfast, it's the perfect time in the day to act as a very good social doctor, full of manners and full of etiquettes. But it's at 2 a.m. in the night when you have your 19th delivery of the day happening, and you've not probably had your dinner. In fact, you don't know when you had lunch, and you are tired and you are, fatigued, and that's the time when your character comes in. So, that's when you realize that in spite of such physical demanding schedule, you have to behave with the patient that you're seeing the first patient of the day. And that's when you, being a clinician, whether you deserved it or you just came in because your mother said or your friend said that you should become a gynecologist or a surgeon or a physician, that's when it comes into play. So, if you take any clinical branch, please, upfront I'm telling you, it's going to be a demanding life, and Obs and Gynae even more so. So, those who are feeling that yes, I must sleep at 11 in the night and I must get up at 8 in the morning, I must have my jogging time and I must have my time to go for all the conferences which are happening in the country and international conferences, and I must also have time to go and take care of my gardening habits and go and attend the flower shows. I don't say that you should not do these branches, but yes, you may have to compromise a lot in your private lives. So, your primary interest in life has to be Obs and Gynae, then only you should do this branch. So, I'm not scaring you, I'm just trying to tell you that's a demanding branch. Once you understand this part of your life, then you're going to enjoy it thoroughly. Because once you know that yes, I'm committed to this, I'm committed to this in such a way that it's going to be taking out the best out of my life towards the patients. Now, if you don't like this, then go ahead and pick up any other branch which is non-clinical. Don't think that it's Obs and Gynae is demanding and surgery is better and medicine is better. See, there is sweat and grime in any branch. There are bad hours in any branch. If you're thinking that in surgery you have much cleaner patients and there's much lesser noise and there's much lesser dirt and grime, then you are mistaken. You must go to the OPDs of surgery, you must go to the wards of surgery, you must go to the wards of orthopedics. Everywhere you will have sweat and grime and you will have a demanding schedule. So please don't compare based on the amount of work and the cluttered OPDs and the overloaded labor rooms and the ICUs to tell you that I can't do this branch. So as a clinician, one of the best branches is Obs and Gynae, where you can take obstetrics, you can do surgery, and you can do so many other specializations when you do your MD or you do a DNB. Whatever you do, after that, the super specialization opportunities in Obs and Gynae are many more than what they were around 20 years back. Yes, once you become an obstetrician and gynecologist, you can branch into fetal medicine and you can branch into high-risk pregnancy. And these are exciting new branches because you're taking care of the baby right from the beginning till the time the baby is delivered, and you're making sure that you have taken such good care that in spite of having a disorder, see, normal pregnancy anybody can manage. Those 10% high-risk pregnancies, they require high-risk obstetrician specialists or fetal medicine specialists who are going to diagnose with ultrasounds, who are going to intervene with ultrasounds or do fetal surgeries if required, and manage these patients in such a way that in spite of disorders, in spite of some structural defects, you can get these babies out in perfect shape and give this baby a healthy life. So that kind of challenge in fetal medicine, I'm telling you, it's one of the most exciting branches where people are doing their FNBs or their super specializations across the world and coming back and giving extremely good care to the people back at home. And you can now do urogynecology as a specialization because you don't want to do just obstetrics, you want to do something different. You want to specialize into pelvic floor, you want to do surgeries for repair of the urethral defects, stress incontinence, you want to do transvaginal tapes or transoperator tapes, you want to do needle suspension procedures, Birch corpus suspensions. These are surgeries which a gynecologist used to do as part of his work, but now this has become so specialized that when there are these defects, they're looking for urogynecologists, and believe you me, there are not so many of us in urogynecology, and it's a relatively unexplored field, urogynecology, and there are many centers offering courses in this, and I'm sure they're going to come out with a degree course also in urogynecology very soon for gynecologists. Then you can also specialize into laparoscopy. And look, all of us do gynecological work, like you can do hysterectomies and you can do the prolapse repairs, and there's so many other gynae surgeries like, you know, ovarian cystectomies and radical procedures like a radical hysterectomy. All of this nowadays can be done by laparoscopy. And the thrill of doing laparoscopic work for such extensive surgery is limitless. I'm telling you, when you're doing a 3-hour open radical hysterectomy and you do that work in 1.5 hours with a laparoscopic work, and you do it's so much better that the patient can actually walk back home within 2-3 days of such a big procedure. That's so mentally rewarding, and that gives you that special kick which a surgeon wants when he's doing open surgical work. And now this is coming through laparoscopy. So you carve a niche for yourself. He's a laparoscopic gynecologist and he does all the surgeries with a laparoscope and does such a good job. Remember, laparoscopy actually started with gynecological surgeries. So we guys are inherently tuned to do the laparoscopic work because you know, there's so many more surgeries in gynecology than any other field. But yes, laparoscopy is increasing tremendously and endoscopy is increasing tremendously in all the fields. But yes, primarily as gynecology, there is a lot of laparoscopic work and you have a good scope to specialize as a surgeon there also. Another exciting branch is reproductive medicine, or like we call it, reproductive medicine and surgery, which is work of infertility. Now, when you're doing infertility work, you must have a lot more patients than other branches in Obs and Gynae because you're essentially dealing with a couple who is very healthy. Physically, they don't have any limitations, but they're not having a child. So you must make them understand the procedures which you're going to give them as options, and the lot of expense which is involved, and of course the number of times they have to come to you for the treatment. And the success is not that I'm going to have you get a pregnancy within 6 months or maybe 2-3 years. You know, there's no limit to the treatment because it is not a short kind of a science. You may at most have a success of 45% with the best treatment modality, IVF and ICSI. The best success is 45 to 50% in most clinics. So it's one of the branches where you must have a lot of patience to discuss and make the patient understand, because when pregnancies don't happen after spending 1.5 to 2 lakh rupees for IVF cycle, then you can be at the end of receiving a lot of uncomfortable sentences from the patients. So do it only if you have the patience to discuss with the patient, and then only get into reproductive medicine and surgery. And yes, along with laparoscopy and reproductive medicine and surgery, that is a killing combination. So if you are doing IVF and along with that you are a good laparoscopic surgeon, then your range of surgery and your range of patients increases even more, because you can do the repair of the defects which are leading to infertility rather than just doing the medical management of infertility. So if you're deciding to become an IVF specialist, then never do IVF immediately after MD. Please, you must do your 3 years of MD, then get another 1 or 2 years of experience in doing the general gynae work and general obs work, and then get into reproductive medicine and surgery, because you know your basics. Then doing infertility work, correction of defects, and doing that laparoscopically, then you become a complete reproductive medicine and surgical specialist. And I think one of the least chosen specialty after doing obs and gynae is oncosurgery. Gynae-onc is so untouched that those who want to do good surgical work and massive surgical work, have a lot of patience of standing and doing this work, must go into gynae-oncology, because it's totally untouched. A lot of urologists, general urologists and a lot of general surgeons are doing this work for us, and there are a lot of oncosurgeons, a lot of gynecologists who are oncosurgeons nowadays, but it is very limited. So a general surgeon and a urologist doing gynae-oncology work and a gynecological surgeon doing gynae-oncology work, you can understand easily that a gynecologist who knows the basics of the anatomy, has been operating and doing hysterectomies all his life and has the skills to do that laparoscopically, now stepping into gynae-oncology, he'll be a person who will be the sought after surgeon for oncological surgeries more than any other general surgeon or a urologist who is doing this work so far. So these are so many specialties which you can choose of, and I always say that there's a dearth of the basic obstetrician gynecologist. I spoke about so many specialties which you can get into, and you can do so much of specialized work, but the basic obstetrician, let me tell you that as a parting statement, that is becoming a very rare species. The person who is going to take a woman right from her conception till the delivery and make her have a normal vaginal delivery, that person is becoming very, very scarce. That specialty is very much in place, and those who are doing normal deliveries now, again, they are the new obstetricians. They are the people who are different from others, because arey ye to normal delivery karta hai, because this is something which is becoming so rare. The incidence of cesarean sections in private hospitals and in a lot of corporate hospitals, and I've been always talking about them in my app also, that the art of doing normal vaginal delivery is going to stay forever, and those who are going to do that are going to be loved by the patients more than the ones who are doing elective surgery. A lot of people want elective cesarean sections, we know that, but if you are able to deliver them normally, you are going to give them a normal body very soon. They are going to recover much earlier. Normal is always the best, and that's how nature decided us to have children. We must have them normally. So those who are going to do normal obstetrics, please don't think that you're doing something which is primitive. You're doing some very good work. So there is a place always for a good obstetrician who's going to do labor room work and a gynae clinic work and the antenatal clinic work. There is a lot of place, lot of demand of such people who do good obstetric work. But yes, before anything else, I would also want to tell you that it is not always just to do an MD in Obs and Gynae. If you're getting to do DNB in Obs and Gynae, please don't think twice. You want to do MD in Delhi, you get DNB in Delhi. At least you got the choice of your subject in the choice of your city. It's a DNB, please, it's not a compromise anymore. Don't think that you are not going to pass because you're going to give a DNB exam. That is actually a very, very old phenomena, because what happened earlier, DNB was given just because you spoke in an interview very smartly and people liked you and they gave you the DNB seat. Yes, it happened that way, and I know it because I work in a DNB institute and I've gone as examiner to so many DNB institutes. So I will say this by experience, not because I've heard of it. So now what has happened for the last 10-12 years, DNB is given only after you clear an exam. So now there are so many of us writing this exam. So obviously the ones who are doing well will either get MD or a DNB. And in the government, you get the same jobs, you get the same importance when you're going for an interview. And please don't think twice. If you don't get the MD, please, DNB is not a compromise, it's an alternative. And it's a good way to settle down fast. I always say, if it is your first attempt, please get what you wanted. You wanted MD, you wanted MS, you wanted it in subject, but if it is your second choice, but if it's your second attempt and you're not getting the place of your choice, but you're getting DNB in the place of your choice, go ahead and take it. Please, if you're getting the subject or the place, but it's a DNB, why don't you go and take it? It's settlement, it is fast, and it is definitely the exam which is more value. Let me tell you that. Why am I saying that? Again, personal experience. When I wrote my MD exam, there were 4 people who were taking the exam, but 2 of them were my friends. They were my teachers. I've worked with them throughout my MBBS and throughout my MD. They knew me personally, and they knew that this guy's worked so hard. Even if I had blundered something, I would have passed. Of course, it didn't happen that way. We did fairly well in the exams, but yes, there are 2 people who are taking care of you in the MD exam. But the day I passed my DNB exam, when I gave the interview, and I knew that I have passed this exam, because when I gave that exam, there were 4 externals, and to make them have a smile at the end of your long case, and they're telling you that, doctor, you've done well, that gives you the kind of confidence which nothing else can give, because they are 4 strangers, they don't know you, they don't have a list of things which you achieved in your life so far, and they don't know that you were the best speaker in the debates which happened in your college. There's nothing like that happening in DNB. So yes, the DNB exam gave me that confidence, right, I have passed this exam, I must be worth the degree which I've got now. You know, it gives you that extra bit of confidence. So I'm very happy when I extend my name writing an MD and a DNB. That gives you so much more confidence, because yes, the DNB gives you the added edge. So I'm always saying, those who are picking up DNB and becoming specialists, they are not lesser than the MD any day. They are equivalent. Please go ahead and take exams. Everybody will pass. I'm telling you, because you're reading, you're working hard and you're reading. Why would you fail? Why do you think that DNB is going to make you fail? You think MD is going to make you pass? You think everybody who's writing an MD has passed in the first attempt? Please, I mean, when I wrote the exam, I was very close to not making the grade. Yes, I can tell you that very straightforward. Yes, I had a problem in my exam and I was very close to not making it. But yes, I made up in the other cases and I made it in my MD. So please don't understand that MD is a straightforward guaranteed degree in 3 years. You may take 4 years, you may take 5 years also to pass your MD. And similarly in DNB, if you've not worked hard and if you've not had the clinical experience and you've not read well, you will not pass your theory in the first place. So DNB and MD both can make you have the results which you deserve, which is always a pass, because you worked hard and you read hard. So if you present well, who is going to stop you passing in a DNB? Please choose any of these. So winding up, let me tell you that if it is your first attempt, get what you like. That's what is called achievement. Get what you like. You wanted MD, you wanted DNB, you wanted this subject, you wanted this place, you got what you wanted, that's achievement. But if it is your second attempt, like what you get. No, I'm not telling you to compromise, but yes, it's important to settle down. So those who are second attempters here and listening to this talk from me, please understand, like what you get, because third attempt you may not get even that, because the number of students writing this exam, number of people coming into the country after passing the MCA exam, it's already increasing tremendously. So who knows, you may not even get the subject which you're getting now. You know, I'm not trying to discourage you at all, but I'm giving you very practical advice. If it is your second attempt, settle down now. You tried twice and you got this, and it's a decent option to have a life. Please go ahead and make a life for yourself. All right. So thanks for going through this detailed talk, and I hope you have a carry-on message about Obs and Gynae, and of course about clinical life, which I was trying to tell you. And I hope all of you, wherever you do your post-graduation, and if you're dealing with patients, I mean, if you're doing the clinical branches, then become a humane PG. You know, I want you people to understand that patients go through a lot when they come to you, and as patients, you would have also seen that when you have to get to a doctor, you have to, you know, match your schedules with going and seeing a doctor and trying to get his attention, and finally the doctor is short-tempered and he's not talking to you properly and he's not giving the time you deserve. You feel so bad that you tried so hard to come to see this doctor and he was not very polite to you. So please place yourself in that situation. So when it's 2 AM, once again I'm telling you that, And that time when there's a poor patient who's come to you with a child who's got septicemia, don't yell at that child and say that why was this child not brought to you in the morning when you were more comfortable. The child is sick now, he has come to you at 2 a.m. and you've done pediatrics, you better take the care of the child as he deserves. It's not because the child wanted to come to you only at this time. He was brought to you at that time because he's sick at that time. So please try and understand that it's a clinical branch. If you're deciding, it's going to be a demanding branch. So please don't have any shortcuts in taking care of such patients. All right, become a human PG. And I don't want to know, if you're my students, I don't want to know that you were yelling at a patient because he came to you at 3 in the morning. Please, that's the time when I'm going to feel very, very bad, because you were my students and you went through this discussion with me. All right, so make a very, very good decision, take a very good clinical branch, and if you're taking Obs and Gynae, welcome to the gang of the reproductive medicine specialists, welcome to the gang of the urogynecologists or the oncosurgeons, and welcome to the gang of fetal medicine and high-risk obstetricians. So yes, welcome to the clinical life, welcome to Obs and Gynae, and if you're going to be here, then I'm sure you're going to have a good life because you chose to have this life, not because you were pushed into this life. Like I said, do it because you want to do it, not because you were pushed into it. Once you make that up, then you're not going to have any problems. All right? So welcome to Obs and Gynae and make a very good choice. Have a very good life. Thank you.